Okay, so surgery was a year ago, so we're
a year ago tomorrow.
We're a year ago, so we're just about a year here. So let's take a look at how the knees are moving. All right. So we'll start with the left knee. Left knee looks nice and straight. Push all the way down.
It's actually straighter than the right.
Yeah. Looks great. Bend your knee for me. Fantastic. So it's about 125 degrees. Looks great. All right, let me just check side to side. Relax. You're always going to feel.
Makes a lot
You're
of
always going to
clicking.
feel that clunking, clunk, 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 because your knee is now made out of metal and plastic.
Yeah.
Everybody's knee, mine and yours before the surgery, goes side to side a little bit. Okay, but usually you have meniscus and cushiony stuff that protects that, makes it more sort of like this. Now that you have metal and plastic, it's thunk, 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 thunk.
I think this one makes more noise than the right.
Most people, and push down on this side.
See, this one doesn't go down as good.
Okay, relax. Relax here. Let it bend. Just let it heavy.
Yeah.
It feels about the same amount of overall side to side. Because this knee is tighter overall, you probably don't feel that clunk clunk as much. So tight equals less clunking, but sometimes a little more stiff.
I'm trying to.
So it's kind of a balance between.
Any chance I'll still get it knee straighter?
You're fine.
I mean, it's okay.
You're 2 degrees
I know
off. You're 2 degrees off.
Not as perfect as the other one.
So if you make it too tight, it won't make the clunk clunk, but it won't move well. You make it too loose, it'll move really well, but too much clunking, clunking, clunking. So you have to get it somewhere in the middle. All right. This one's on the tighter side of good. This one's on the looser side of good. So that's why this one you feel maybe more clunking, but it moves much easier. And this one you feel less clunking, but it's a little bit stiffer. So it's sort of a balance. You can sit back up.
Is it the device that makes it, or
there's so many things that go into
everything?
So you're talking about millimeters here. You're talking about tiny fractions of space. So when you cut the bone, the width of the saw blade, if the saw bounces off a little bit and creates a millimeter extra bone, you'll be 1 or 2 degrees tighter. So you're talking about tiny little amounts of bone that you can cut off the end of the bone. If you cut this much bone instead of this much bone, you're going to end up with a couple degrees of difference. So just the variables.
I mean, I'm fine with it.
Just the variables
but I'm aware that this one isn't quite as
of surgery. But
this one kind of goes like this.
If you hadn't had your left knee done and I looked at your right knee, I'd say that's perfect. You know, it's exactly what I want. I actually want a little bit of tightness. So, but once again, you can't match it to those 1 or 2 degrees.
The other thing I noticed on this one, the knee, I guess it's my own kneecap, but it's kind of pointy feeling here. This one's all nice and rounded.
Sometimes there's either,
you see what I mean there?
sometimes a little stitch there, sometimes the way you cut the bone, but overall, we're not too worried about it. All right, so let's see here. Let's take a look at your X-rays. Okay, X-rays look good. So here's the kneecap view. All right, I'll show it to you too, not just the camera. All right,
cool.
So kneecap view there, both look fine. And then let me see here. And then here's your front view. Everything looks good. Alignment looks good. This is your right. This is your left. Looks perfect. And then here's your right view from the side. And then here's your left view from the side. Both look great. Okay. So 1 year out now, you still have to take the antibiotic before you go to the dentist. Okay. And
last time I forgot till I got there, and I said, "Oh shit!" But I got home right after.
Nope, no cursing on video.
Oh.
Now certain age groups can't watch it. It's pretty controversial on whether or not you have to do it.
I mean, I just had a cleaning, so I took it the minute I got
There are plenty of people who don't do prophylactic antibiotics anymore because some of the literature shows it doesn't really make a difference. Most people still do it, but no great science to it. We know that there's extra blood flow to your knee for 2 years after the surgery, so we figure if there's extra blood flow and there's bacteria in your blood, those bacteria could go to your knee, so that's why we do it for about 2 years. Okay? So I recommend it for 2 years, and then the next time I have to see you back would be at 5 years after the surgery.
So do I see you at 2 years or no?
No, this is just
for 5 years.
Yeah, I don't need to see you back until 5 years after the surgery.
Okay.
Okay. The chances of anything going wrong between now and then are almost zero. And
I still have these.
Yeah, the lumps. Your knee's always going to feel
I always
a little.
have those lumps.
Probably. Yeah.
Why? Everybody doesn't.
Most people are a little. Most people actually. The reason why they don't have those lumps. Most people are more swollen than you are.
Oh.
So most people have more of a rounded off to their knee where you still have some degree of contour. So most people, when you look at their knees after knee replacement, it just looks like a round circle. You know, it's just all puffy. Because you're not puffy here, the one area puff is there. You're going to have more fluid inside your knee just because of the nature of surgery. That fluid has to go somewhere. It usually presents itself as either lumps here or lumps there because that's just fluid from inside the knee.
It's weird.
Yep.
Pretty ugly.
Nothing you can do about it. And once again, like I said, your knees are actually much less swollen than most people after a knee replacement.
Really?
Yeah.
I have to say that, strangely enough, like right after Thanksgiving, I felt like I had more I wouldn't say pain really, but you know, they're not what I would call pain-free or discomfort-free, and I didn't do as much exercise through the holidays because I was just so damn busy. I didn't have time. So I don't know if I didn't do enough or I did too much.
You know, here's the thing. You're going to have good days. You're going to have bad
Sometimes
days.
They're still
you're going to say, wow, it's been 6 months. I forgot I had surgery. And then the next day you're like, wait a second, why my knee's hurting today?
Yeah.
This is the nature of these knee replacements. On average, make you 80 to 90% better. Okay, that still means that there's still stuff. That stuff can happen. It can be soreness. It can be this swelling. It can still be trouble kneeling. It can be trouble going downstairs. It can be soreness just out of the blue. You don't have normal knees. You've got metal, plastic in you, you know, and this is the nature of the surgery. Yeah, exactly. And when you don't do your exercises for a while, if you don't do your exercises for a while, your knees will feel it.
And I still feel like when I go upstairs, I still feel it here. Is that normal?
If there's any complaints that last almost through the rest of your life after a knee replacement, kneeling and stairs. Those are the two things that I hear forever after a knee replacement.
But like,
not as I can't do them, but if there's any complaints that are consistent over the course of a knee replacement, stairs and kneeling are typically the two things that most people, for the rest of their lives, just say, if there's two things that I always notice that my knees bother me on, it's stairs and kneeling. But,
I went to Hong Kong in September, and I don't know if you know about it, there's this big Buddha there, and there are 289 stairs to the top. I did it.
Well, I mean, so...
But that was easier than sometimes 3 flights in my office right now.
And also, if you're sitting for a long time and your muscles aren't that activated, then you try to do stairs all of a sudden, your muscles will feel it. If you're out and about and you're walking and then you just do a whole bunch of stairs, you won't feel it as much because your muscles are more engaged and more active. So, like when you first wake up in the morning, you're stiff and everything has to stretch out because when you've been sitting for a long time, your muscles have become sort of sleepy, and then when you try to really stress them by doing a bunch of stairs, they'll feel it.
Oh, one more question. Like when I do the leg machines at the gym, like a leg extension, for example, I've been gradually adding more weight. I used to do 110 on the leg extension like this.
Yeah.
So now I'm just up to about 60. I think I probably could do more, but is it hard on the knees? Should I not do more?
It's not hard. It's not hard on the knees.
But
it's
I can
just
still
some
build up
things
more
will
to
make
build this up.
Some things will make your knee. Some exercises will make your knee okay, and some will hurt. When you do those, you should never go past. Go ahead and push. You should never go past about there. Okay? You shouldn't try to get all the way straight. You should stop around here. The safer machine to do, the better machine to do, is the plate press. You know when you're sitting in that chair and you got both your feet on that plate. That's a safer one to do. More,
I can do a lot on
it stabilizes your knee as you're doing it, and then you don't want to go too deep. You want to go to about maybe 90 at the most. You don't want to go way past. So you want to go from almost straight to about 90 and then back. That's the better exercise.
My legs are still pretty strong here. I got them pretty good.
But in terms of gym stuff, in terms of machine stuff, that's the better one to do.
And the bike.
Bikes are great. Bikes are great. Elliptical's great.
A real bike.
A real bike, yeah, sure.
I don't know how to do hills properly with the easy gear, so I grind up the hill. Is that gonna
so number one,
mess
you
up
cannot.
these new knees?
You can't do anything to mess them up. You can just cause soreness. You can cause, if your knees are really like, if you did a whole bunch of twisting exercises and jumping exercises, you probably just wouldn't feel great. You're not messing up the implants. You're not wearing down the plastic faster. You're not doing anything like that. you're just doing stuff that your knee doesn't want to do because you don't have the same ligaments in your knee. Your muscles are still not perfect, so. And it's really the ligaments. The fact that we have to cut out the ACL and the PCL, which are the two main stabilizers of the knee. Your knee now uses the muscles.
You just don't have those.
You don't have those anymore. But the implants recreate those motions, and it requires more muscle strength. Because there's a lot of people who tear their ACLs and PCLs. We don't do surgery on them, but then we rely on their muscles to do what the ACL and PCL used to do.
Oh, I see.
So when you do certain exercises that you used to think were fine because you had your ACL and PCL, now you're putting a different type of stress on your knee, and you're requiring your muscles to do that, and sometimes your muscles are ready for those things, sometimes your muscles will never be ready for those things. There are certain things that you were able to do before that you won't want to do now, and that's where stairs are. Stairs really put a lot of stress, unstable stress on your knee, and with your ACL and PCL, it handles that. Without that, unless your muscles are rock solid, most people, once again, stairs are the thing they don't love.
I make myself.
Not bad to do. Not hurting your implants. Not hurting your knee. But once again, it's just the way your knee feels.
I just make myself do them at the office, and
I don't want you to avoid them. I just mean it's normal to say I don't love stairs.
Okay, but so I can't really hurt my knees by
the only thing you can do to hurt your knee
grinding
would be to get in a
hills.
major car accident, fall down a bunch of stairs.
That doesn't happen.
You have to do something really, really big to hurt your knees.
Because I thought doing my hills on the bike the way I do them wore out the old knees.
No.
You don't think that's what happened to my old knees?
No. Your old knees wore out because of genetics and time and wear and tear, but not because you were exercising.
Oh, okay.
Yeah.
Good.
Okay. All right. Good. So I'll see you back in 5 years or 4 years from now. All right. Any questions before then, you let me know.
Okay.
Even if you fall down, you see black and blue around your knee. Once again, these things are solid. You would know you did something bad because you wouldn't be able to stand up. You would be questioning. If you ever ask yourself, I wonder if I did something bad, you didn't do anything bad. You would know, you'd be calling 911, you would be able to stand on it. That's the only way to do. That's the only way.
That never
exactly.
happened.
In other words, you fall down and you go, oh no, it's black and blue, something must be wrong. If you can stand up, nothing happened. All right?
Okay. That's
okay,
good.
All right. I'll see you in 2020.
Okay.
All right.